Hey Fred, you had a heck of a time urinating in the past. Prior to coming to the office here, can you tell us what you were feeling?
Yes, I can. About 4 or 5 years ago, I started noticing a lot of intermittent urination and increased frequency at night. And so I went to another urology doctor and had an evaluation, and we talked for a while. And he says, well, you're not quite ready for the procedure yet. So I came back about a year later and talked to him again, and he showed me some of the options available. And I decided at that point I was going to wait a little longer because the symptoms weren't too bad. Over the next 18 months, they got worse, and I came to see Dr. Lin, and he did a scope on the bladder. And everything looked like it needed immediate surgery. So we went ahead and scheduled a surgery. He removed portions of the prostate with a TURP procedure. And the recovery was pretty much textbook. It worked very well, and I was pretty satisfied with the result. I'm 4.5 months out now, and everything looks good. So I'm happy, and if anything else changes, I'll be back to see Dr. Lin.
Can you tell us how you said things have gotten better. Tell us exactly what you experienced.
Well, the volume of urine flow has increased remarkably, and so I can empty the bladder essentially all the way now without any hesitation, and I don't have to get up in the nighttime nearly as frequent. I still get up, but that's partly because I have volume load at night, and I tend to have to get rid of that.
All right. And how has that improvement in urination changed your quality of life?
Oh, it's markedly improved. I sleep better at night, and in addition, I don't have the same issues with respect to having to go as often during the day. So it's much easier to manage at this point.
You're one of the very few patients I have who has a lot of insight and a lot of understanding about enlarged prostate and treatment options. How did you get to that point?
Well, when I first started having some difficulties, I did go to this urology physician, the other doctor, and he basically told me about some procedures. And then I went home and I looked them up on the internet and did some research with urology research papers that are out on the internet that you can review. So I gained knowledge by doing background research on my own.
Very good. Now that you've recovered from this procedure, for guys who have trouble urinating due to an enlarged prostate, what are your thoughts? What can you share with them?
I think your best option is to come in early and come in often.
Very good. Well, thank you so much for allowing me to interview you.
You're welcome. And thank you for the excellent care.
You're welcome.